Hi, I'm Dr. Joanne Smith.
And I'm Dr. Corinna Hankins.
And this is
A Pod Full of Pediatrics.
If you want to follow more of our content, subscribe here.
Or you can visit us at onecommunityhealth.org.
Or follow us on social media at One Community Gorge. And this is one where we talk about
Pertussis and the DTaP vaccine. Right. So this is our second episode. So we're picking another vaccine this time for this month, and we picked pertussis because we've been having a lot of pertussis.
There's pertussis outbreaks every year.
Yeah.
And pertussis is whooping cough, right? That's what we call it in English. In Chinese, it's called the 100-day cough.
Because it lasts 100 days.
It's a really long time.
It is really awful.
You remember in Espanol?
Tosferina.
Oh, which sounds so much prettier than it is.
It is. It really is. But it's still really bad.
Yes. So it's caused by a bacteria called Bordetella pertussis.
Yes, and it's a highly contagious bacteria that's spread through respiratory droplets. And the bacteria itself attacks the breathing passages, and that makes it really hard to breathe.
Yes. It was first identified in an epidemic in 1578 in Paris. You know, Paris is always good for a good infection.
A good,
like
good horrible
bed bugs.
Pandemic, epidemic, whatever.
Yes, exactly.
But before the vaccine in 1940, widespread disease with the highest mortality in infants.
Yeah. But the vaccine made a huge difference. I mean, in the 1930s, 250,000 cases in the U.S. Were reported, and then by this 1970s, it was down to 1,010.
Yeah, which is huge.
The vaccine was very effective.
Yeah, really effective. We still have, that was with universal acceptance in the United States.
Of the vaccine.
And that wasn't the whole world.
Right.
And then a lot of places in the world don't have as good of vaccine programs as we do. And so pertussis still affects about 240 million children a year. And most of those are less than 5 years old that actually get sick from it. Interestingly, it is one of those things, pertussis, that anybody can get pertussis at any age. And for most adolescents and adults, it is just annoying, right? Mm-hmm. It is, but 100 days of cough is super annoying.
And it's not one that you really build up immunity to.
No.
You can get it again and again.
Again and again. And that's the other part of it, is that even though we vaccinate for this, it does wane. And so as you get into those adolescent and adult years, that's why we kind of started boostering now with the vaccine, because we were noticing more and more outbreaks in those older groups of people who were more dangerous to infants. And so while the oldest groups for adolescents and those have this annoying cough that lasts for 3 months, and I will tell you, they keep coming back into your office, right? I want something to stop this cough. I want something to stop this cough. And then you finally go ahead and do the PCR and test for it, and you're like, yeah, you got pertussis. So nothing I'm going to give you is going to stop this cough. This cough is here for 100 days.
Right.
And that's the sad part about it. And it stays miserable for that whole time. It's not even like you have this worst part in the bit. You're still coughing and having episodes of cough where you might even vomit afterwards for the whole 3 months, which is really miserable. But for babies, it's dangerous.
Right. And that's why a lot of the babies, they don't even cough very much because they're not big enough or strong enough to cough. They just really have a hard time breathing.
Right. In fact, they don't breathe. They're just apneic and turn blue with breathing and or trying to breathe. And a lot of infants who are especially less than 6 weeks old, although it's dangerous really in that first 6 months, but especially for those first 6 weeks, can be super dangerous to babies. And those are often the ones that we have the most trouble with. The mortality of severe pertussis was 34% with patients younger than 6 weeks, and accounted for about 76% of deaths.
It still is.
Yeah.
And so, as we talked about with the other vaccine preventable illnesses, this kind of starts out like a cold. Right? It's just like a runny nose and a cough. And so it's hard to know who actually has it until they start having more progressive cough. So they're spreading around to people without even knowing it.
And the incubation period's forever.
I know, right?
7 days to 3 weeks.
Yeah, most of our viruses is kind of 2 to 3 days. After exposure, you're gonna get sick. But this could be up to 3 weeks after exposure.
Yeah, so it is really long. And then the first part you don't know. And then after a week or two, you progress to cough, and that cough progresses even more. And you have these coughing episodes with these really big, deep breaths. So you cough, 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 whoop, right? Like, and then after that, you then can kind of cough, 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 and then you throw up, right?
Yes.
Like, so it's just miserable.
And we treat pertussis with an antibiotic, but it doesn't stop it. It just stops you being contagious.
Right. So you aren't going to give it to other people, but it does nothing for the cough. So you are still going to cough just as badly before we gave you as before you gave the antibiotics. But at least you're not going to give it to your siblings or friends or that type of thing.
Right. So the vaccine was developed in the early 1900s, 1914, and it was called a whole cell vaccine.
And actually, the first vaccine was pretty effective, which is why you saw that reduction like so much. Like the whole cell vaccine was really pretty protective and worked really well. It did take a while to get like a universal acceptance of it. And then we actually ended up adding two other things, the diphtheria portion of the DTaP vaccine, which is in 1926, and then the tetanus, which came in 1938. And then we combined all of them in 1948.
Right. And that's where the letters DTP came from. So three different bacteria.
Right. And then what we found is that first one, the whole cell vaccine, this is kind of the fascinating thing about vaccines is that we don't just, like this vaccine was made and then tested extensively. And then we were like, okay, great, this is working well. But what they noticed was that it had a lot of side effects. Right. And those side effects being a lot of fever and higher fever and could lead to things like febrile seizures, which again, like we said in a previous episode, typically aren't dangerous seizures, but very scary.
Very stressful,
and very stressful. And so they also had this weird, like hypotonic, hypo-responsive episode, which I gotta admit, I am glad I'm
so glad this vaccine change happened early in our, like when we were medical students, so we never experienced really DTP side effects. We just saw DTaP.
Right.
But there's this episode could happen where basically the kid would be really low tone and unresponsive, and they would be fine afterwards, but can you imagine that?
No,
terrifying.
It would be really scary. And that was like 1 in 500 people.
Yeah.
So it was actually kind of a big one. And so they're like, okay, we have this great vaccine. It works wonderfully, but we don't really like the fact that it has these side effects. Parents don't like it. It's very stressful. So they actually reworked it and they took it from a whole cell vaccine in the 1990s to a acellular pertussis vaccine. Yeah. So instead of DTP, it became DTaP or DTaP, which is what we call it now.
Yes.
And that was really great because it stopped a lot of these side effects. You didn't have these weird hypotonic, hyperresponsive episodes anymore. Fever went down to much lower grade fever, so we don't see febrile seizures. And typically the things we see the most are arm pain, irritation. Sometimes they'll get, especially with your 4th and 5th dose of DTaP, you can get some like arm swelling, like so bigger part of the arm or leg.
And that's your body saying, whoa, something just happened, which means your immune system is responding, which is the whole point.
And it's not a bad thing and it's not dangerous.
And in 2 days it's better.
And in a couple of days it's better. Although it can be not fun to have.
No, absolutely not.
But the hard part about it, and this is the part that's a little hard for me, is that, by making it have less side effects, it also isn't quite as effective. Right. So before you had that with that whole cell pertussis, even that first dose worked really well. And this time now for the pertussis portion of this vaccine, it's only about 40% effective at that 2-month mark. By your 6-month mark where you're getting on your 3rd vaccine, it's about 80%. And you don't get above 90% until you hit that 15-month and then your 4-year-old vaccine ones.
Right.
So the 15-month will give you over 90%, and then you booster it at 4 to 6 years, and that stays over 90% then. But that first bit is not as effective now, which is why it's so important to do some other things to protect children too at that time until that immunity can be up to 80% at 6 months.
Right, and that's kind of the recommendations changed. Now when people are pregnant, they recommend getting a Tdap, which is like the adult version of this vaccine, every time they're pregnant, because they noticed that a lot of the outbreaks were from older school-age children coming back home with the cough, giving it to the mom when she was pregnant or right when she just had the baby, and then the infant getting pertussis. Right,
and so this was, and I actually saw this quite a lot when I worked in the hospital before we had before we made the recommendations for pregnant mothers and teens to get this, was that we would have these babies who actually, that was a large part of the problem. They kind of came in and it had waned in teens, or mom caught it from somebody else and then gave it to the baby. And the babies in the hospital with pertussis, it's just miserable. They're there for months.
Because it's a 100-day cough, right? So it takes that long to clear the illness.
Right. And so this was really helpful. So what we've noticed is that since we made this recommendations for moms to get it during pregnancy, and also had another like adolescent dosage at 11 and then again at 18, we are actually really decreasing our pertussis burden for infants and children, like young children, which is huge.
Right. And that's like the whole thing about vaccines. It's a risk-benefit ratio, right? Is that we want to protect our most vulnerable, which this for pertussis is absolutely the infant, but without having too many side effects, right? So our vaccine is less effective than it used to be, but we have less side effects with it, and so more tolerated. And so we kind of have that balance of, you know, keeping them safe without a lot of side effects.
And then if we do protect both parents and adolescents, we also prevent them from having the 3-month cough.
Right.
Again, it does wane though. So if like, I feel like most of the times when I saw this in the fall for my teenagers, it was at a time like right before they were supposed to get the next vaccine. Like I was like, man.
So close,
So it had waned, and unfortunately they still got pertussis. But for the majority, it didn't really spread horribly within our community. And that's because we do have a high vaccination rate for this in our community, luckily. Yeah. And I haven't seen this a lot in babies, thankfully, again, because I think we have a higher rate of vaccine. If you look at other areas where the vaccine rate is lower, their pertussis outbreaks are much worse, and they often have it with babies, who have the most risk.
So unfortunately, because our vaccination rate is declining, we are seeing increase in pertussis cases.
All over the country.
Yeah, for sure. And again, there's no treatment, right? There's antibiotics to stop it spreading, but you have to know it's that to be able to treat it.
Yeah. And again, you know, some of the rumors were that this just didn't work as a vaccine, but that is not the case at all. It actually is effective. We just had changed it to make it less side effects. And so we do need to have other people in the population kind of done too. Now remember, there are 2 other things in this vaccine.
There's a T and a D.
That's right. And the D is diphtheria, which is a bacterial infection that typically affects the nose and throat. We very rarely hear about this at all.
We've never seen it.
I've never seen it.
It gives you this gross pseudomembrane that's like this
gray
membrane over your vocal cords.
You can't breathe. You can't swallow, and it was deadly. And so you couldn't intubate. Like it was really horrible.
But hopefully we'll never see it.
Hopefully we will never see it. It also causes some serious complications like heart failure and paralysis. Diphtheria did. And again, we have eliminated that pretty much entirely with the DTaP vaccine.
Yes.
Tetanus, though, we are never going to eliminate.
It's still going to be around, and that is lockjaw, right? And it's caused by Clostridium tetani. That's a bacteria that is in the soil, dust, poop, everywhere. All the things outside, basically.
Yes. If you go outside, you can be exposed to tetanus.
For sure.
Right? Like that's just it.
And it typically enters through a wound, but it could be like a very minor scratch or a little like nail, cuticle thing, right?
Yeah.
Like it doesn't have to be a huge wound.
So if your kids are out playing in the dirt, there's a chance that they could come into.
Playing in the dirt.
We want them to be, right? We want them to be outside and playing, but they could then get exposed to tetanus. Unfortunately, and the real reason we vaccinate for tetanus and why we find it so important to vaccinate for tetanus is that we have no effective treatment for tetanus, period.
Right. And it is lockjaw, so you get muscle spasms and stiffness, and your whole face just kind of locks up that you can't swallow or breathe.
Right. And it's super distressing. Kids are miserable. Adults are miserable if they get lockjaw. You can give IV fluids. We give a lot of anxiety medicine. Often we have to intubate again. There is no medicine that can treat tetanus, period. Yes. So we are just supportive care until they get better, if they get better.
Right.
And so we need boostering of tetanus. So we need the vaccine for tetanus, and then you need to booster it. And again, tetanus is another one that wanes. So it is a very effective medicine, or a very effective vaccine, but only for about 7 years. And so after 7 years, you need to get another vaccine. But with that, you have really good immunity against 3 different things. So the other thing that we've heard a lot about is that some parents are a little bit worried, and we're going to try to kind of address some worries around vaccines with each one of our vaccine talks from now on.
Right. So the first one we get asked a lot about are what ingredients are in vaccines? What are all these extra things in there that are dangerous? And the answer is there are no extra things in there that are dangerous, right?
But we do have the vaccines themselves are basically have antigens. That's actually what helps our body develop an antibody to those antigens.
Yes.
So antigens are basically a part of...
It's just a word that means it's a part of a disease so our bodies can respond to that disease.
And make an antibody that we can use to protect us any other next time our body gets exposed. Right. So it creates the immune response, and those are the antigens. And there's different types of antigens, and it's important because that's actually how we make different types of vaccines. So the first type of antigen is an inactivated or killed virus. It does not even cause mild disease, but the body still recognizes that killed portion of the virus and makes it makes a response, makes antibody to it. And those are like your polio and Hep A. Vaccines.
So next time your body would see that disease, it would I know what to do. I can get rid of this.
I can get rid of it. And there is no mild disease. That's what we were saying about polio. It is so easy. Hep A, so easy. It does cause no disease, no symptoms at all. Then you have the weakened live virus, these are viruses that are weak enough that they're too weak to cause disease, but can prompt a strong immune response. And that immune response then helps them from then on make great antibodies that will respond anytime they're exposed again. And this is like measles, mumps, rubella, the vaccine we talked about on our first show, and then rotavirus and chickenpox.
Yeah. And then there's ones that have a subunit of a dead virus. So it's just, a tiny little portion. It'll cause no symptoms, and this will be like the Hep B vaccine and the HPV vaccines.
Right. And then you have the final type, which is actually DTaP is that type, which is the partial bacteria, which is a portion of the dead bacteria that, again, initiates that immune response that anytime they're, again, show up with tetanus, like in the soil, it would respond. We'd make antibodies right away, and you'd never get sick from it.
So that's the primary component of every vaccine is just a tiny bit of the actual disease that is not enough to make you sick, but enough to trigger an immune response.
And that's called the antigen.
Right.
Okay. And then your other common ingredients are typically like preservatives that keep from bacterial contamination as the vaccine is processed or out and after processing. And then adjuvants that help our body create the immune response. So sometimes, to have a strong enough immune response, you add an adjuvant that and it's something added. That is adjuvant. That's the name.
Yeah, exactly. That's what the word means, adjuvant.
It's something added.
I like to think about them as little flares or high-vis equipment where it's
hello,
look
that's
at me,
good.
come on over here.
That's a great way to respond. And that actually makes our body respond, right?
Yeah.
It's oh wow, yeah, this is not
something's
good for
happening.
us.
I should check this out.
I should check it out. And then you make an immune response. And so again, those adjuvants can be aluminum or additives like lactose, glycine. They help vaccines stay safe and effective when stored. And typically, the residuals of this vaccine production process are really very tiny amounts of other things too. So when we do produce the vaccine, there are other preservatives that help it. And those are things like egg protein, neomycin, formaldehyde. And formaldehyde sounds scary, right?
It does. It is the thing that you're always oh, that sounds like poison. But it's in so much of our life. Right? It's in almost every fruit, especially apples and pears. And our body is very good at filtering out anything it does not need.
Right. And this one, formaldehyde specifically for vaccines, is actually a way to inactivate the virus. So typically they're in that viral vaccine ones, and they are used to inactivate it. So it's how we kill the vaccine. But then we process that vaccine, and we actually take out most of the stuff, so including formaldehyde. So what's left at the end of part of it is a tiny, tiny, tiny bit of formaldehyde. You will, if you eat apples, pears, foods, other things, you're going to get 100 times more formaldehyde from those than you would ever get in all the vaccines we have altogether.
Right.
Right. So that's how you can think about this. It is a preservative that kind of helps, or not even a preservative. It is something that we use to inactivate the virus, but it is totally taken out after production of the virus.
Right. And then there are some antibiotics in some of the vaccines, and neomycin and polymyxin are the ones that are used the most. And those are ones that are used in over-the-counter triple antibiotic cream, right? So something that we're exposed to all the time that our body does not react to. It's very safe, and they're almost undetectable during the processing.
Again, they are taken out. Most of those are taken out, but it does really help keep the vaccine safe and prevent it from getting contaminated.
Right.
And then you have egg protein.
Right.
So we have like particularly 3 of the viral ones, of the viral vaccines we have are actually produced in eggs or egg type things. And so there can be a trace amount of egg protein in the final product. These have been studied a ton, especially influenza. And so we know for sure, influenza and MMR, that for influenza, you can safely give even kids who have egg allergy, influenza and MMR, and they will not have a reaction.
Right.
They will not have
anaphylaxis. That, have egg allergy, and they have had those vaccines safely, and we always make them hang out a little longer, and everything's always okay.
It's always okay, yeah. And so those 2, the one that actually you do have to be careful of is one that most people aren't going to get here anyway.
Yeah.
So it's yellow fever.
Right. So that vaccine you should really talk to your doctor about
if you're allergic. Yeah, because that one you probably shouldn't get. And then aluminum. Like this is a big topic. Everyone's like, oh, we can't have aluminum in our vaccines.
Aluminum is all around us, right? It's in our soil, it's in our water, it's in our food.
It's actually the most, it's the
metal.
Most metal in the Earth's crust.
Is a metal.
Aluminium. British.
Aluminium. Couldn't say it right.
But yeah, it is the highest metal in the Earth's crust, right? So it is in everything that we eat and touch. So basically, what I tell parents is that, again, this is an adjuvant. It is mostly processed out. What is left over, our body processes out really well because it's, again, everywhere in our environment. So our body is actually used to peeing and pooping out aluminum all the time.
It's very efficient, our body.
It is very efficient. Our body is amazing. And if you are breastfeeding and eat veggies and fruit,
which you should,
from the ground, we totally want you to do that. You're going to give your kid more aluminum that you're going to get in
and
the
it's
vaccines.
Okay. You're not hurting them.
They are not.
Totally fine.
It is not dangerous. So again, those are kind of the ones we do it. And then, are there harmful additives?
Let's talk about what's not in there. So there's no antifreeze.
Right.
Antifreeze, chemical name is ethylene glycol. It's absolutely not in vaccines. Polyethylene glycol is in vaccines, which again is a additive that is in most foods and most products we have, and our kidneys get rid of it fine, and it's totally harmless.
It's in like cosmetics and medicines and
it's
foods.
in Miralax.
Yeah, it's like all over, right? And it is used to inactivate and purify some vaccines. The polyethylene glycol, ethylene glycol, antifreeze is not in vaccines.
They sound
ever.
similar chemical compounds, but so do carbon monoxide and carbon dioxide, and we know that those things are really
very
different, right?
Yes,
so it's just a chemical naming, but they're not the same thing.
Right. And so they're not in there. The other thing that's not in there is mercury.
Mercury, right.
And they are not in vaccines. Mercury has actually never been in vaccines.
Right.
There was thimerosal, which was a mercury-containing preservative.
It was a derivative.
Not preservative. It was acting as a preservative, but it was a mercury derivative that has actually been removed from all childhood vaccines since 2001.
This whole millennium.
And this whole millennium. None of their children now in the last 20 years have gotten this. But it never caused any problems, even before.
No.
They did a ton of studies with thimerosal, and it had never caused any problems, was never an issue. But just to be safe, and because they didn't want to worry people, they took this out. It did not have any contact. It did not cause autism. In fact, autism rates have gone up even since 2001 when this has been removed. Yes. And again, it is not in vaccines.
Yes. And then fetal cells,
yeah,
stem cells. So they absolutely are not in vaccines.
Right.
Some vaccines were developed from some fetal cell lines from the 1960s from some embryos that were donated to medical science after a natural loss, after miscarriage.
And those actually, they used it's like the bone marrow with the cell lines from the bone marrow that they actually now have still a ton available, and they are their lifespan is indefinite. Like we can use those over and over and over again. So you don't need other ones.
Right.
And the purification process, again, during vaccine production, there is no fetal tissue included in any final version of a vaccine. And it really the only ones that even are grown grown with this are typically the ones, viruses, where you have to grow in human culture, cell culture. And that's actually just that portion of it. And then again, purified, there is none in it. And again, there's no recommendations for ever needing that.
Right.
So really what we are kind of hoping that you get from this is that the number of additives in vaccines is really very small. All of the ones we have, we're already exposed to in much higher doses than any other thing we do. And very naturally, this is all natural things that we would be exposed to anyway. And our bodies are really good at taking care of it, which means that, as we've said before, vaccines are very, very safe and effective and the best way to keep your child healthy, safe, and happy.
Okay.
Yeah.
All right. So I'm Dr. Joanne Smith.
And I'm Dr. Corinna Hankins.
And this is a pod full of pediatrics.
And thanks for listening.
Thank you.